everyone, my name is ROSELYN. I'm a clinical nurse and this is my channel. Today I'm going to talk about scans in pregnancy or fetal scans in pregnancy. Pregnancy is made up of 3 trimesters, and in each of these 3 trimesters there are scans that need to be done to check on the status of the fetus and also to check on the well-being of the mother. When you get pregnant, it's not just about your belly's changing. As the body develops and changes, so does your mind. It is essential that you get these scans done so that you'll be able to address any abnormality in your baby in the early stages. Keep in mind, all the tests and scans will give you an idea of the different aspects of development in your baby that is growing in the womb. So there are 4 scans that are done during pregnancy. Scans are done in various stages. In the first trimester, we have the viability scan that is done between 6 to 10 weeks. In the same first trimester, we have another scan that is done between 11 to 13 weeks and 6 days. This scan is called narcotranslucency scan. In the second trimester, there is another scan that is done between week 18 and 20. This is the anomaly scan. In the third trimester, we do a growth scan. A growth scan that is done between 28 weeks till delivery. I'm going to go through the details of each and every scans that I've mentioned. But before I give you the details of each and every of these scans that are done in pregnancy, that is the 4 scans, there are some important tips that I would like to highlight. Usually for pregnancy up to 14 weeks, scan is done optimally with a full bladder to ensure that the baby is well visualized in the uterus. Do not empty your bladder until after the scan is done. After 14 weeks, there is no need for a full bladder because that time the fetus is well grown and can be well visualized. There is no need to fast for any pregnancy scan, or in other words, for any obstetric scan. There is no need to fast for any pregnancy scan, as it is always good to eat something so that you can remain energetic. Scans are dependent on baby's position and therefore may at times take longer than expected. Prepared with some extra time in hand in case there is need. So like I had mentioned, in the first trimester, this is the first scan, that is the viability scan, that is done between 6 to 10 weeks. This scan determines and confirms the pregnancy. It also determines the site of the pregnancy, whether it's occurring inside the womb or outside the womb. It also determines the number of embryos, age of the fetus, of heartbeat, and also checks the normalcy of pregnancy progression. There is a limitation in this viability scan in that it provides limited information on the well-being of the fetus, as it is too soon to detect because by that time the fetus is so small. Duration is about 5 to 10 minutes. Still in the first trimester, nasal translucency scan is done, or the Down syndrome screening scan. This is done between 11 to 13 weeks and 6 days of pregnancy. This scan is important because it calculates the due date of delivery. It also diagnoses the exact number of fetuses and the possibilities of early miscarriage. It also assesses the risks of the baby developing Down syndrome and other chromosomes-related conditions and the risk of preeclampsia. Few of the severe abnormalities in the fetus can be diagnosed. One limitation for this scan is that 1 in 15 women can get a false positive result or false alert of risks of Down syndrome. Also, in regards to this scan, a positive result to Down syndrome does not confirm the problem, but further diagnostic tests are needed. And not all fetal abnormalities can be picked from this type of scan. The duration is between 10 to 15 minutes, and for this scan, a full bladder is needed. In the second trimester, we have the Anomaly Scan that is done between 18 to 20 weeks. Scan examines each part of the fetal body to detect major abnormalities and screen for markers for chromosome problems. It also measures the fetal growth, the amount of liquor, that is the amniotic fluid that surrounds the fetus and protects the fetus. It also gives good details about the placental position and the cervical status. This scan also can give details about the sex of the fetus. Limitations that come with these scans are: baby's position may impact the scan in that you may be asked to come again to complete the screening. It can also identify major abnormalities. However, some may develop later in pregnancy. The duration of the Anomaly Scan takes between 20 to 30 minutes if the baby is in good position. That trimester, that is the last trimester, we have the growth scan, which is done between 28 weeks up until the delivery time. The growth scan or the wellbeing scan measures the size of the fetal head, abdomen, and the thigh bone. It also calculates an estimated fetal weight. It examines the movements of the fetus. It evaluates the placental position and the appearance to ensure that there's good supply of blood to the baby. It also measures the amount of amniotic fluid. Limitations to the growth scan are: closer to due date, the accuracy may be compromised due to the growing size of the baby. Estimated weight usually have errors of up to 10%. The duration is 15 to 20 minutes. It's always important to make sure that your obs-gyn goes through the fetal scan that are done in various stages in pregnancy. In case of any abnormalities, it's well addressed and further tests done if need be. Thank you for watching. Hope this content was very informative, and wish all mothers to be safe delivery.